Hi, Dr. Keppel. I know that you deal with young, old kids, and bladder infections tend to be something that I think, regardless of your age, many people deal with that, at least a few times in their life. So, do you see very many people that come in and they actually have either an active bladder infection or they're prone to bladder infections?
Yeah, absolutely, Tracy. And the thing about bladder infections, along with any kind of infection, is we've got to get the host built up. We got to get the stronger. We got to get the tissue stronger so that they can resist the bacteria that come along. So when you get a person that has an active infection, Mark Anderson has told us one of the first things you got to do is acidify. Cal-Amo primarily. Cal-Amo is going to work better and longer in the body to systemically acidify than apple cider vinegar will. Think about apple cider vinegar like kindling wood for a fire. It's going to burn real fast and burn off. But the Cal-Amo is going to stay in the system longer to help acidify. Germs don't like that acidic environment. That's the first thing. Second thing, when the active infection, they need to get some cranberry complex from Mediherb and drink cranberry juice. And what's really cool, I found this out, I thought it was awesome, that what the cranberry does is it makes the wall of the bladder and the urinary tract slippery so that the bacteria can't latch into the walls of the tissues and set up camp and then start proliferating. So cranberry complex from Mediherb is vitally important. And then of course, what's the other thing? We got to give the body the ammunition it needs to go and kick some germ butt. And it doesn't matter if the germ's a bacteria or a virus, doesn't matter what kind, the body just wants the ammunition. So what's the ammunition? Calcium lactate. We've talked about how that mobilizes the white blood cells. Cataplex C with the J factor helps give strength to those white blood cells. Mark Anderson calls it the poison tip of the spear to annihilate those bacteria. Okay, so we need those two things. We could also use some ribonucleic acid that increases white blood cell production, and also the thymus gland. The thymus gland is the master immune gland. Well, guess what? All four of those things just happen to be in Conjuplex. So if I have an active infection, if I load them up with Conjuplex, like 2 every half hour, every hour for a couple of days and really hit it hard, but if the infection's really bad and maybe they're laid up pretty good, now I'm going to want to take that Conjuplex, spread it out in its individual components. And then one other thing that's very important in these active bladder infections is Arginex. Arginex to help detoxify the kidneys and also help detoxify the liver. Okay, so that's for an active bladder infection. Now, people that get recurring bladder infections, once we get that infection under control, we can back up. We could also use some Mediherb products, like Andrographis, Viranon if it's a virus, okay, Echinacea, things like that. So if they're prone to bladder infections, well, now we want to use Echinacea on a regular basis. We want to use Imuplex to help the main portions of the immune alliance, okay? And we can still use the Conjuplex, but we want to strengthen that bladder tissue. So we want dermatrophin as the protomorphogen. Cataplex AC, which is in the Conjuplex, also will help strengthen the bladder. Maybe sometimes those people need a little extra vitamin A, Cataplex A, to help with those epithelial linings. And then there's even another step that many people don't know about, they don't think about, thyroid support. Somewhere along the lines, you got to check that person's thyroid. Make sure that their thyroid is functioning, because without that thyroid hormone, thyroxine, the cells become weakened and people can be more prone to having interstitial cystitis and different bladder infections.
All right, so Imuplex to help prevent, Conjuplex for active infections, along with making sure you acidify with Cal-Amo. It's kind of like the whole thing in a nutshell.
And throwing in some Mediherb immune support products as well.
So do you ever use Rena-Food much?
I will use Rena-Food when there's more of a urinary tract infection coming from the kidneys. So I use Rena-Food a lot, just not necessarily in bladder infections.
Okay. Thank you, Dr. Keppel.
You're welcome, Tracy.